Hi everybody, I'm Bobby Martin. I'm going to just do a video for this discussion post and talk about immunization hesitancy through the lens of the health belief model. So immunization hesitancy is a huge public health challenge, and the health belief model gives us a great way to break it down. So people don't always just refuse vaccines outright. Sometimes they just delay them or feel unsure, like me with my Shingrix. But the health belief model explains why that happens by looking at the factors like their risk perception, their barriers, and their motivation, and one's demographic and psychosocial circumstances that all influence a person's likelihood to act. So we have to look at a number of factors to see what influences motivation. So for example, someone's perceived susceptibility plays a big role. If someone doesn't think they're at risk for a disease, they're less likely to see the need for a vaccine. And then there's perceived severity. If they don't believe the disease is that serious, they might not see the need for a vaccine as being important either. But on the flip side, we know even if they do see the risks, that they might have concerns about side effects or think the vaccine won't work. So everyone's kind of going to be, weighing their perceived benefits and barriers here. Social influences is a huge factor and plays a key role in the likelihood of behavior change. So, for example, a recommendation from a doctor or seeing others get vaccinated can push someone towards taking action. But what determines the likelihood of action includes self-efficacy. Things like scheduling an appointment feels like a hassle, or they're unsure where to go, they might just put it off. So all of these together become a person's cues to action. So the main assumption here really is that people's decisions are influenced by their perceptions. So if we can shift their perceptions in the right direction, we possibly can change their behavior. But as we all know, information isn't always enough. So we need to ensure that our patients have the social support they need, accessibility, and trusted messengers to make an impact. So a bunch of things influence vaccine decisions, and a lot goes into whether someone chooses to get vaccinated or not. So for our assignment, we were asked to do this through an ecological model, and it'll just be easier to break it down looking at the barriers and motivations at different levels. So at the individual level, this is what we believe and what we know. So at the core, vaccine decisions come down to the individual. Things like personal beliefs, past experiences, and knowledge, they all play a role. Fear of side effects, however, misinformation, and thinking, I probably won't get sick, can hold people back. And money also matters. Having a stable income, insurance, and financial know-how makes healthcare decisions a whole lot easier. But trust in science, good experiences, and knowing how vaccines work can really encourage them. On an interpersonal level, this is really who we listen to. These are the people around us, our family, our friends, our coworkers, and doctors and nurses heavily influence choices. So if there is misinformation spread around in social circles, or our cultural beliefs discourage vaccines, people might hesitate, but strong recommendations from trusted doctors and nurses or hearing good experiences from friends can really be a game changer. And financially, having, again, support from family or friends can help cover medical costs is beneficial, while obviously lack of support makes things a lot tougher. At the organizational level, where we work and how easy it is to get vaccinated also matters. So if scheduling's a hassle, wait times are long, or employers don't support time off for vaccines, people are less likely to get them. So on the flip side, if there's workplace vaccine clinics, that is helpful, or public health clinics. Reminders from doctors is another way to impact here. And good insurance, again, paid sick leave, affordable healthcare options, that really these types of things that ease that burden. And we all know how the gaps in these kind of coverages make it harder. At the community level, the bigger community plays a role too. Some areas that we live in have more trust in public health programs, while others might be skeptical. Costs obviously remain a barrier, especially if affordable options aren't available. But community efforts, really like local education campaigns, partnerships with clinics, and outreach in different languages help build and trust and make these vaccines more accessible. Including like financial aid programs, charity clinics, are really those lifelines. But if they're not around, like in these rural communities we're all very familiar with, those people struggle more. Finally, big picture policies shape everything. If public health messaging is inconsistent or funding is lacking, which it has been over the last 6 weeks severely, vaccine uptake suffers, which we've seen by this horrible measles outbreak across the country. But as we know, and let's hope we can keep pushing this message forward, clear communication, free vaccine programs, school workplace mandates, all of these types of things can help. And policies around healthcare costs, like insurance premiums and copays, make a difference. But as you know, that's all currently changing as well. So let's wrap this up. We know vaccine hesitancy is complex and it's influenced by all of these overlapping factors. And, we really need to think about applying our motivational interview techniques to address these factors on these different levels, targeting, the individuals, the social networks, the healthcare systems, the communities, and the public policies. And take this comprehensive approach, we can hopefully improve vaccine confidence, its accessibility, and also uptake across all of these diverse populations. So thanks a bunch. Hope you like this instead of just reading a bunch of notes. And let me know if you have questions. Thanks. Ciao.